Kind enough to join us this morning, speaking of sports medicine, is Dr. Derek Eddy from Sports Medicine Center, and he is a team physician with the University of Akron. And Dr. Eddy prepared to talk to us about injections in the world of sports medicine. And Derek, why don't you take it from there?
Yeah, so thanks for having me. I thought I would start by kind of break it down by body part. Joints are the first area that I want to talk about. Joints can get just an inflammation and a pain process called synovitis, where we can put a little steroid in there and just kind of break that pain cycle. Most of the time, those patients have failed the conservative management, therapeutic exercise, and oral medications, and we can just put a little steroid in there and kind of break that cycle and help them out. Osteoarthritis is another common joint issue. And we can, again, start with steroids. A lot of the time that's first line. We've had it for decades. It works well. We also can do what's called viscosupplementation, which is artificial joint fluids made in the lab, designed to look like a young person's joint fluid. And it's kind of like changing the oil in your car engine. The other thing is platelet-rich plasma, where we take the patient's own blood, take a tube of blood, and we process it to get all the platelets in that blood concentrated down just to a few cc's, and kind of releases the growth factors, the natural healing properties of your body. And with osteoarthritis, there's actually level 1 evidence, which is the best evidence for knee osteoarthritis, so it works really well. The other areas of the body other than joints is soft tissue, and primarily when we're talking injections, you're usually talking about tendons. Now, steroids, you cannot inject large tendons with steroids that actually will cause rupture. You can do smaller tendons. We've been doing that for a long time. An example of that would be like a tennis elbow. But what the research shows that it does work for a short time, but long term, it actually does not do very well. So when we're talking about tendons, I really do prefer to use that platelet-rich plasma, PRP, because again, to kind of help induce the body's healing process. And then all these injections, 90% of these injections that I do are under ultrasound guidance. So I'm watching the needle go into the precise location where we need this medication to go.
I love that technology, too. They can go precisely to where that injection needs. Okay, a couple of questions. And with us is Dr. Derek Eddy from Akron Children's Hospital. Derek, when we talk about the steroid injections, and you mentioned to help them out for a while, talk about how long that steroid injection can help out an individual and how many of these steroid injections they can have to help out that particular area.
Sure, that's usually the first question I get. Like, how long is it going to last, and how many do I have to do? Right.
Yeah.
So again, that's what I tell the patient is it could not work. Right. That's a possibility. And then sometimes one injection, and I've had it last for years. Seeing patients see them out and about, and they're like, "Yeah, doc, I'm still good after years." But again, probably the majority is in the middle there. Right. So again, depending on the disease process. Again, more of a synovitis, usually one and done. Osteoarthritis is a progressive disease, so it keeps happening, it's not going away. So, months, again, up to a year sometimes with those.
And then how many can you get in that particular area?
Yeah. So how many can you have? Again, there isn't. The research doesn't really say how many, but typically the response is 3 a year per that area. Again, we try to minimize it as much as we can. Again, it depends on the disease process. Again, if it's like a synovitis, if it keeps happening, it's like, okay, what else is going on here? Like, we need to kind of address the root of the issue.
We hear different things, especially in the world of football, that's foremost with us, with MCLs, ACLs, those type of things. Can injections help into that area, or is that surgical help there? But can an injection help in that area?
ACLs, not so much. MCLs, because they do heal, on their own. There is, some anecdotal evidence and that injecting TRP again into that area can help kind of maybe speed that along.
What about muscle strains, like a hamstring strain, strain in a different area? Does an injection help into those areas as well?
Again, we're using PRP for those areas to try to get get more growth factors in the area to try to heal up the speeding process.
When we talk about those steroid injections, Derek, you give the injection and let's say you're going into a specific area, how long before the patient notices a difference?
Great question. So typically with a steroid, you're looking at least between that 24 and 72 hours was where you start seeing a difference.
All right. Derek, thanks for the time, the education, my friend. Always appreciate it.
No, thank you very much for having me.
Mm-hmm.
Have a good day.
You as well. Dr. Derek Eddy with us from Sports Medicine Center, Akron Children's Hospital.